Hi ma'am, sir. Good afternoon. My name is Moises Pakansa from Batch 18A Group 2. Today, I will be presenting the case study of pernicious anemia. Case objective: be knowledgeable about pernicious anemia, understand the symptoms of pernicious anemia, know the complication and prevention of pernicious anemia, understand the risk factor of pernicious anemia, make an appropriate nursing care plan for the patient who suffered from pernicious anemia. Pernicious anemia, a form of vitamin B12 deficiency, anemia that is an autoimmune condition where the body not produce intrinsic factor which plays a role gastrointestinal system absorbing vitamin B12. Overview: pernicious anemia is often an insidious and underdiagnosed autoimmune disorder which can lead to fatal complications. The most appropriate way to supervise the disorder is through interprofessional and interdisciplinary teams that include a primary care plan, care physician, internist, gastroenterologist, neurologist, oncologist, pharmacists, and nurses. The healthcare team should strive to increase awareness of the disease and therefore promptly test for it. The nurse can intervene in primary screening during triage by asking the signs and symptoms suggestive of underlying anemia, neurological or gastrointrinsic manifestation. The most at-risk population include people over 60 years of age. These older individuals should receive prospective screening for possible vitamin B12 deficiency. Once treated, the patients should be supervised routinely by their physicians. What are the signs and symptoms of pernicious anemia? Signs and symptoms of pernicious anemia are as follows: diarrhea or constipation, lightheadedness when standing up with exertion, loss of appetite, mild jaundice or yellowing of your eyes and skin, dyspnea mostly during exercise, heartburn, swallowing red tongue or bleeding gums. Risk factors: having a family history of the disease, having type of diabetes mellitus or other specific autoimmune condition, having hard part of your stomach removed, being 60 years old or older. Prevalence of pernicious anemia. The age at the time of diagnosis of PA varied from less than 10 years, 7 individuals, to greater than 80 years, 3 individuals. The most frequent age at the diagnosis was age 41 to 50. It accounts for 20 to 50% of the documented cases of vitamin B12 cobalamin deficiency in adult according to the recent series. In the general population, the prevalence of PA is 0.1% in subject over age of 60 and reaches 1.9%. It often poses diagnostic and therapeutic challenges to the clinician. Burden of anemia and its underlying causes in 204 countries and territories. Mortality. Why was pernicious anemia so fatal? Before medical researchers found a cure, pernicious anemia was a universally fatal disease that caused overwhelming fatigue and breathlessness with even the slightest movement. The body does not develop enough of red blood cells to carry oxygen because the digestive system can't properly absorb vitamin B12 from food. Complications. Possible complications: people with pernicious anemia may have gastric polyps. They are also more likely to develop gastric cancer and gastric carcinoid tumors. People with pernicious anemia are more likely to have fractures of back, upper leg, and upper forearm. Pathophysiology. The primary pathophysiological mechanism in pernicious anemia is diminished dietary B12 absorption due to IF deficiency intrinsic factor. The parietal cell make and release a substance that the body needs to absorb vitamin B12. It secretes intrinsic factor. It also possible for gastric acid secretion, which aids in the digestion of food, absorption of mineral, and control of harmful bacteria. IF is a glycoprotein produced and secreted by parietal cells that binds vitamin B12 and facilitate its transport to terminal ileum for absorption. Anti-IF antibodies inhibit B12 from binding to IF, preventing B12 IF complex formation or binding to the B12 IF complex, preventing intestinal absorption. Parietal cells are present in glands within the fundus and body of the stomach and are largest cell in these glands. Acid degrades meat releasing vitamin B12 cobalamin. In the duodenum, B12 binds to intrinsic factor. Intrinsic factor shuttles B12 into the ileum. Ileum is the last part of the small intestine. It is at this point the vitamin B12 will bend to IF intrinsic factor for the remainder of its journey to the ileum of the small intestine for absorption. What causes anti-parietal cell antibodies? Atrophic gastric inflammation of the stomach lining, diabetes, gastric ulcer. In pernicious anemia, the body makes antibodies that attack and destroy the parietal cells. What is the difference between pernicious anemia and vitamin B12 deficiency? Pernicious anemia involves autoimmune inflammation in the stomach and inability to absorb vitamin B12, while vitamin B12 deficiency anemia may be caused by lack of B12 in the diet. Diagnostics and procedure. Doctor will diagnose pernicious anemia based on the patient medical and family histories and physical exam and the test results. Medical and family histories are as follows: had any stomach or intestinal surgeries, have any digestive disorder such as celiac disease or Crohn's disease, diet and any medicine intake, have family history of anemia or pernicious anemia, have family history of autoimmune disorders such as Addison disease, type 1 diabetes, Graves disease, or vertigo. Diagnostics and procedures. Physical exam. During the physical exam, the doctor may check for pale or yellowish skin and enlargement liver. He will listen to the patient heart for rapid or irregular heartbeats or heart murmur. He may also check for nerve damage or reflex by checking your mental status, coordination, and ability to walk. Complete blood count, often the first test used to diagnose many types of anemia, is complete blood count (CBC). A CBC check the hemoglobin and hematocrit levels. Other blood tests. A reticulocyte count measures the number of young red blood cells in the blood. The test shows whether the bone marrow is making red blood cells at the correct rate. Bone marrow test. Whether the bone marrow is healthy and making enough red blood cells. The two bone marrow tests are aspiration and biopsy. Upper endoscopy. Doctor use a thin tube instrument with a light lens for viewing called an endoscopy to look sign of degeneration or atrophy, wasting away, or blinding of your stomach. Chilling test, a medical investigation used for patients with vitamin B12 cobalamin deficiency. The purpose of the test was to determine how well a patient is able to absorb B12 from their intestinal tract. Vital signs: normal temperature 37 degrees Celsius, blood pressure 110/80 mmHg, pulse rate 60 to 100 beats per min, respiratory rate 12 to 20 breaths per minute. Patient profile: name Mrs. Anderson, age 70, sex female, civil status married, birthday January 9, 1953, final diagnosis pernicious anemia. History of illness: Mrs. Anderson was diagnosed with pernicious anemia at the age of 70. She has monthly appointments with her primary health care provider for treatment with vitamin B12 injections. Subjective data: she said she noticed a decreased sensation in her finger. She can pick a cup but she can't really feel the cup in her hand. Objective data. Her laboratory test result with a complete blood count, CBC revealed red blood cells RBC 3.20 million per mm3, mean corpuscular volume MCB 130 UL. Reticulocyte 0.4%, hematocrit HCT 25%, and hemoglobin HGB 7.99 DL, and prescribed as Schilling test diagnostic procedure. Complete blood counts. We have test result unit reference range. RBC is 3.20 million mm, 3.80 to 4.80, MCB 130 UL, 83.0 to 101.0, reticulocyte 0.4%, 0.5 to 2.5, hematocrit HCT 25%, 36.0 to 46.0, hemoglobin or HGB 7.9, 9/DL 12.0 to 15.0. So in this slide, I'll show you the table of physical assessment. So we have parts of body technique, use, findings, interruption. Medications. She has monthly appointment with her primary health care provider for treatment with vitamin B12 injection, cyanocobalamin crystalline, cyanocobalamin nasal gel, nascobal and hydrochloric acid, HCI. Cyanocobalamin oral vitamin B12. Cyanocobalamin crystalline injectable vitamin B12. Cyanocobalamin nasal gel, nascobal. Hydrochloric acid, HCI. Next is the reference for the medicine for this case. So there is a generic name, brand name, classification, caregiver's responsibility. Nursing care plan. In this table, we have nursing assessment, nursing diagnosis, plan expected outcome, nursing interventions, rational evaluations. So we have subject here, decreased tingling sensation or fingers, objective, weakness, fatigue, weight loss, abnormal lab result. In nursing diagnosis, the patient will verbalize decrease of numbness, tingling sensation of her fingers. Patient was diagnosed with pernicious anemia as evidence of decreased sensation on her fingers. Plan expected outcome. Patient will endure the performance of affected fingers will be improved, be able to perform activities of daily living with limits of present conditions. Nursing intervention. Educate the patient about the importance of eating enough food with iron, vitamin C, and folic acid. Educate the patient about the medication, vitamin B12 IM. Encourage patient to engage a physical exercise as tolerated. Educate the patient on safety to avoid accident. Educate the patient in good oral hygiene. Rational. To have enough healthy RBC to carry oxygen to its various parts. Evaluation. After the intervention, the patient was able to continue her daily activities. Goal met. Discharge plan. Maintain regular clinic follow-up with medical providers. Educate regarding the symptoms of anemia. Educate regarding the red flag symptoms suggestive of gastric complications. Encourage and emphasize compliance with lifelong therapy. Healthcare teaching. Patient requires teaching regarding the importance of long-life therapy to prevent clinical complications. They also required teaching regarding the risk and gastric cancer despite treatment and red flag symptoms that should prompt evaluation. This includes new or worsening dyspnea, bloody or melanotic stools, unexplained weight loss, loss of appetite. If self-administration of B12 injection is planned, they will require teaching regarding the administration of IM injection. So the last part of this presentation is the source information. And that's all. Thank you very much and God bless.